At TriHaz Solutions, we don't just manage waste. We manage risk, responsibility, and reputation. Trusted, compliant, done right. The medical spa market is experiencing strong growth, driven by increasing demand for non-invasive cosmetic procedures. Overall wellness trends and an increasing demand for age-defying treatments are also propelling the market. In the United States, the industry was valued at $6.45 billion in 2024, and is expected to grow to $25.84 billion by 2034. Unfortunately, some practices are unaware that their cosmetic procedures legally classify them as medical waste generators. Non-compliance can result in heavy fines and health risks to patients and staff. Med spa owners need to know this. If your procedures involve skin penetration or blood, even a single microneedling session, you generate regulated medical waste or RMW and must manage it accordingly under state and federal laws. TriHaz takes a look at med spas and aesthetic practices and how their waste should be managed. What is a med spa? A medical spa, or med spa, is a hybrid facility that combines traditional spa services with certain medical treatments under the supervision of licensed healthcare professionals. These facilities often have a physician or nurse practitioner on staff. Treatments can involve prescription medications, injections, or devices regulated by the FDA. So, what exactly is an aesthetic practice? Well, it's basically a facility that offers non-medical cosmetic procedures, all aimed at improving the appearance of your skin, hair, and body. These places are usually run by licensed estheticians, and they don't involve invasive procedures or any kind of medical oversight, unless, of course, the practice is combined with a med spa. Med spa procedures, which are often considered medical grade, might include things like Botox and dermal fillers, laser hair removal, microneedling with PRP, that's platelet-rich plasma cool sculpting, also known as cryolipolysis IPL, or intense pulsed light treatments Cabela for dissolving fat, radiofrequency skin tightening, and even minor skin lesion removal. Non-invasive treatments at med spas or aesthetic practices are, procedures that don't involve surgery, incisions, or breaking the skin beyond the very top layer, the epidermis. This kind of treatment usually doesn't require any downtime and honestly carries a much lower risk compared to invasive cosmetic surgery. Types of medical waste generated by med spas. Medical spas, and occasionally aesthetic practices, generate regulated medical waste. Proper med spa waste disposal is crucial to ensure all regulatory requirements are met. This type of medical waste may include sharps, like needles from Botox or fillers, lancets, and microneedling cartridges. Biohazardous waste can be gauze or pads soaked in blood or body fluids, and PRP-related waste. Pharmaceutical waste includes expired medications, especially injectables. Chemical waste can come from peels or sterilization agents. There's also contaminated PPE, like gloves, masks, and gowns used during procedures. Aesthetic-only practices may produce non-regulated waste. However, if blood or body fluids are present, they may cross into regulated territory. Managing med spa medical waste. These are important best practices for proper regulated medical waste management. Sharps disposal should always use FDA-cleared sharps containers. Make sure to seal and dispose through a licensed medical waste hauler. For biohazardous waste, store it in red biohazard bags and dispose via an approved bio-waste management service. Pharmaceutical waste needs to be segregated from regular waste. Use reverse distributors or hazardous waste disposal services depending on the drug classification. Record keeping is key. Maintain manifests and logs of waste pickup and treatment in compliance with state and federal laws. And of course, training. Staff should be trained on OSHA bloodborne pathogen standards and local medical waste regulations. The med spa industry has experienced significant growth over the past year. There's also increased consumer demand for non-invasive aesthetic treatments and wellness services as the future of the medical spa and aesthetic industry unfolds. Remember, if you puncture skin or contact blood or fluids even once, you are generating medical waste and must follow all disposal laws. Don't risk patient and staff safety or fines. Partner with a licensed medical waste disposal provider who understands the unique needs of med spas and aesthetic practices. TriHaz Solutions, your partner in regulated waste management. Visit TriHazSolutions.com today.